Hi, my name is Donna Martin. I'm the Associate Dean of Graduate Programs in the College of Nursing. In 2020, we will be celebrating the 40th anniversary of our graduate programs, and we're delighted that we have approximately 500 graduates to date. So congratulations, I'm delighted that you're interested in pursuing a doctoral degree in nursing. Go ahead and reach for the moon because you are already a star. In this short presentation, I will provide you with some rationale for pursuing a PhD in nursing, identify career opportunities for individuals who graduate with a PhD in nursing. I'm also going to explain the application process and provide you with a general overview of the program. You may be wondering, what are the benefits of having a doctoral degree in nursing? The best way for me to answer that question is to provide you with several profiles of our current doctoral candidates. At the top, you'll see Brenda Peters-Watrell. Brenda is a nurse practitioner, and she's very interested in contributing to new nursing knowledge by studying moral distress among oncology nurses. In the middle, you'll see Abir Al-Raja. Abir is really interested in pursuing a career in academia. She is testing whether an online educational tool that she developed will increase the knowledge and self-efficacy about workplace bullying among nursing students. So I'm sure you can stay tuned for the findings of Abir's dissertation. She's currently in data collection right now. And last but not least is Kristen Valeri. Kristen is a director of nursing in the city of Winnipeg. And she's pursuing a doctoral degree in nursing to enhance our understanding of hospital staff engagement. And I'm sure that this information will be really helpful to Kristen and to a lot of nurse managers. This will really advance a lot of our leadership abilities. All three of these doctoral candidates are proposing that their research findings will inform health services policy. In the College of Nursing at the University of Manitoba, the doctoral degree in nursing is focused on preparing students and its graduates for leadership roles in academia, health services, and policy. Here's a photograph of me with Lisa Albensi when Lisa was the Chief Nursing Officer at Seven Oaks General Hospital in Winnipeg. One reason that an individual may want to pursue a PhD in nursing is that it definitely serves as a stepping stone to a tenure track position at a university that's research intensive. And personally, that was one of the major reasons why I pursued a doctoral degree in nursing. I was very interested in honing my skills as a teacher, as a researcher, and providing service to the community at large. Certainly, if you've identified a burning question in clinical practice or a burning question from leadership or from nursing education, you may be really interested in pursuing a doctoral degree in nursing to develop new knowledge. Here's a photograph of Amy Zaborniak. Amy is a first-year doctoral student. Here she is presenting a poster of her proposed research at the Canadian Healthcare Workforce Conference in Gatineau, Quebec. The premise of a doctoral dissertation is to develop new cutting-edge knowledge in the field of nursing practice, nursing education, or nursing administration. Amy is very interested in learning about best practices in recruiting and retaining international student nurses. So we look forward to Amy's research. I am a firm believer in mentorship, reflective practice, and thoughtful career development. It's highly beneficial for you to sit down and envision where you'd like to be in 5 years, where you'd like to be in 10 years. Do you want to be a leader in academia, healthcare services, or perhaps you aspire to work with government in developing healthcare policy? I suggest that you identify a mentor, meet with the mentor, and discuss what and where you want to be. The entrance requirements to the PhD in nursing program are a master's degree, and we really look that the applicant has in their master's a 3-credit-hour course on science or theory, a 3-credit-hour course on qualitative research, and a 3-credit-hour course on quantitative research. Your application requires a letter of interest. So you're developing a letter, a 500-word document about your research interest. You would also include a curriculum vitae, the names and contact information for 3 references, and 2 exemplars of your writing, such as a publication, a chapter from your master's thesis, an abstract that's been published in conference presentation, and certainly acknowledgement that you have arranged an advisor and they've agreed to be your advisor. I'm going to get into that a little bit further in the next slide. It's beneficial for you to give yourself some time to prepare the application. It certainly requires a little bit of homework. Carefully think about 3 individuals who will provide a reference for you to the Faculty of Grad Studies at the University of Manitoba in terms of your critical thinking, your academic achievements, leadership, and potential for research success. So it may be someone from your clinical practice, maybe a supervisor in your particular setting, a former instructor or professor. Certainly an advisor for your master's thesis would be a wonderful reference for you. In your letter of interest, and you can see that Faculty of Grad Studies at the University of Manitoba asks for a 500-word letter of interest, you would provide a short biographical sketch and identify your research interests with rationale. And it's always helpful to provide us with a little bit of information about your readiness for PhD studies, in particular, how you plan to manage your work life, studies, and family life. On your application, you are required to identify the advisor, who would be one of our 28 researchers in the College of Nursing. It's very helpful for me to get a sense about who you are and what your research interests are before you apply. So please contact me. We'll have a conversation about your research interests and what method of inquiry you kind of lean to, whether you're a quantitative researcher or qualitative researcher. Here's a link to the graduate faculty in the College of Nursing who are currently seeking graduate students, and I'm going to get into that in a little bit right in the next slide. When you click on that link that I provided you with, you'll get a list of the names of the researchers who are currently seeking graduate students and a really brief overview about what their areas of expertise and what their research interests are. I'd like to provide you with a little bit of details about some of our fabulous faculty here at the University of Manitoba. In the College of Nursing, we have a total of 28 researchers, and 3 of those researchers have chair awards. Dr. Roberta Woodgate has a Tier 1 Canada Research Chair, and Dr. Woodgate is passionate about child and family engagement in health research and health care. Dr. Woodgate has been involved in the procurement of over $46 million in research funds, and she has published over 150 peer-reviewed papers, all with the premise of advocating for children and youth. So if you're interested in children or youth health, Dr. Woodgate is the advisor for you. Another one of our researchers who has a chair award is Dr. Kellie Thiessen. Kellie is a midwife with a doctoral degree in nursing. She's a graduate of our program here at the University of Manitoba. Kellie is passionate about maternal child health and fit-for-purpose healthcare services. So if you are interested in maternal child health or the provision of healthcare services, Dr. Thiessen is the advisor for you. Dr. Michelle Lobchuk has held a National Cancer Institute of Canada, Canadian Cancer Society Research Scientist Award, and recently a Research Manitoba Chair in Caregiver Communication. She is passionate about promoting sensitive communication competence in caregivers, both professional and family. She is currently developing an empathy coach video feedback intervention for student nurses. If you're interested in exploring empathic communication or caregiver health, Dr. Lobchuk is the advisor for you. We are so fortunate to have a new faculty member, Dr. Mandy Archibald. Dr. Archibald is an interdisciplinary artist. She's a graduate of the University of Alberta and has come to us from Australia. Dr. Archibald supervises students with interest in lived experience, arts-based research, applied research methods, and knowledge translation across chronic illness contexts. And she's very well known for her artistic depictions of frailty among older adults. So you could certainly check out Dr. Archibald if you are interested in arts-based interventions. So just remember that I've only provided you with a little bit of a brief biographical sketch and research interests for 4 out of our 28 researchers. So when you and I have a conversation about your proposed research interest, I will then provide you with several researchers that I would like you to invite for a telephone call or an in-person coffee. And then you can have a conversation with them to see if they really fit with your research interests, your method of inquiry, and your personality. Remember that the evidence clearly indicates that the most significant factor in graduate education is the student's relationship with their advisor. You can work with your advisor to establish a simplified version of a research question that pertains to your area of interest. So in your letter of interest, you would identify the advisor who has agreed to supervise you in your doctoral study and your area of interest. For example, Dr. Seuss is going to advise me, and I'm very interested in studying the impact of anxiety on nursing students in clinical practice. And here I've provided you again with the link to the academic faculty. The application is submitted online to the Faculty of Grad Studies, and there's a $100 processing fee. The deadline date for Canadian and American applicants is February 1st. When accepted, we also ask for non-academic requirements such as a criminal record check, a FIA certificate, current CPR certificate by mid-July. We schedule a 2-day orientation for all incoming graduate students at the end of August. And I've left the date for international applicants here. It's a little bit earlier in the process, November 1st. Now I'd like to give you a little overview of the doctoral program. The required courses are comprised of a total of 12 credit hours of coursework. So 4 3-credit-hour courses. And also for the first 2 years, you would participate in a doctoral seminar that occurs once a month over 4 terms. So here's a list of the courses that are in the doctoral nursing program, and you can certainly work with your advisor as to what specific electives you could choose to enhance your preparation for your dissertation. In the Faculty of Grad Studies, 2 courses per term equate to full-time study. So for example, in one term, if you were taking the Advanced Philosophy of Nursing Science course along with the doctoral seminar, that would constitute full-time study. If you're an educator, you're going to be really interested in this. The strong model of advanced nursing practice, and you can see the citation here, is the model that guides our curriculum in the College of Nursing and the graduate programs. You can see at the center the patient, which is defined as individual, family, or community. And in this model, the patient is central with 5 domains of practice and 3 conceptual strands. This model has been adopted by the Winnipeg Regional Health Authority for Advanced Practice Nursing. The model illustrates how nurses with graduate degrees function in each of the 5 domains of practice: direct comprehensive care, education, research, supportive systems, and publications and professional leadership. Advanced practice nurses support the system, which could be a facility, a unit, a program, by developing standards, policies, procedures, and practice guidelines to improve patient care. Scholarship, collaboration, and empowerment are the 3 conceptual strands. You can see those 3 arrows leading into the patient that unify and influence each domain of practice. This model identifies that graduate students and advanced practice nurses develop in their role as experience is gained, from novice to expert at the very top. Other underlying tenets guiding the pedagogy in our graduate programs are rooted in constructivism. We believe that knowledge construction is embedded within the social context in which learning occurs. Our in-class seminars, online discussions. Constructivism builds on each of our students' pre-existing knowledge, belief, and skills. For example, doctoral students enter into the program with an identified research topic and build their knowledge about that specific topic and method of inquiry throughout their coursework, candidacy exam, and dissertation. Here's the trajectory of the PhD in nursing program. We're really finding that the program, you have 6 years to complete, but the program really takes a total of typically 5 years. Your coursework is completed in 2 years. Once your coursework is completed, you would work with your advisor to identify and establish a dissertation committee. Your committee then works with you to plan for your candidacy exam. Related to your topic of interest, method of inquiry, policy implications, significance. Your committee then provides you with 3 questions. You pick 2 and write 2 papers answering 2 out of those 3 questions. There is a written and oral component to your candidacy exam, and that deems that you are then ready to pursue your dissertation proposal. You would then defend your proposal, again, written and oral. You would go through the Institutional Research Ethics Board and then negotiate access to your study participants, conduct your research project, and then write up your results and discussion and defend your dissertation. I make it seem all very simple. That's 5 years in 1 slide. Another bonus of doctoral studies in the College of Nursing at the University of Manitoba is that you would be learning research methods and scholarly inquiry with a wonderful cohort of peers who bring their own diverse research interests and skills. Typically, social events for the doctoral students are held once a term. Another support that we have for our doctoral students is internal and external funding opportunities. For example, in the year 2018, for 100 graduate students, and this is throughout the master's and the PhD program, our students acquired over $345,000 in scholarships, stipends, and research dollars. We're really proud that our PhD program uses a blended delivery method, which means that we offer some classes on site, and the alternative classes could be offered online. But this is not necessarily a 50-50 designation. It differs in every one of the courses. We're excited that in 2019, our in-class seminars, we were using video conferencing to an off-site cohort of 3 students in Red Deer, Alberta. So if you're off-site and you have some colleagues that are also interested in a doctoral program, this is a great opportunity for peer support for you on, at your site, and also for you to collaborate with our wonderful faculty and our on-site students. Students may elect to go part-time, and this provides you with an extra 6 months added to your time of completion. I find that more funding opportunities are available for full-time students, and full-time student status in the Faculty of Grad Studies is 2 courses per term. So you can think about that once you're in the program. So you're contemplating doctoral studies in nursing. Congratulations. Just really want you to imagine the possibilities for your learning, and we would certainly be very supportive of your pursuit to develop new knowledge and contribute to the profession of nursing to enhance patient care. One day, I hope to have your picture up on this web page with your name and a description of your research interests. I'm sure you have some questions about the program and who would be the best advisor for you given your research interests. So here's my contact information. Email is the best way to reach me. And again, I want to say to you, congratulations for considering a PhD in nursing at the College of Nursing at the University of Manitoba. Please go ahead and reach for the moon, because in my perspective, you are already a star.